Imeenda Dadora. Who makes it safe for him? I do.
Good afternoon. Good afternoon, everyone. Welcome to this webinar. I want us to give ourselves like 7 minutes for more people to join, and then we can start once we have a considerable number of people. Thank you. Welcome, everyone. I'm waiting for us to reach 30, and then we can start. So in the next few minutes, we'll be starting shortly. Good morning, good afternoon. A warm welcome to participants joining us from around the globe, spanning different time zones, as we convene for this insightful webinar and embark on a journey of knowledge sharing and collaboration to basically address pressing issues as we highlight innovative solutions together. Heraf, the Health Rights Advocacy Forum, is a non-governmental organization dedicated to promoting a health system that upholds human rights, responsiveness, equity, and accountability. The organization was established in 2006 and officially registered as an NGO in 2007. Heraf is committed to transforming Kenya's health system through strengthened voice, accountability, and inclusive governance, with a vision of ensuring equitable access to healthcare for all citizens. Let me welcome the Executive Director of Heraf, Edward Miano Munene. Welcome, Miano.
Jambo everyone, welcome to this webinar. I feel privileged this afternoon in Nairobi to welcome each one of you to this discussion that is going to help us to comprehend matters climate change and health. I know this is a new area to many of us. However, it's a very critical area that we need to pay attention to, and therefore we discussed this and found it possible or very important that as an organization with our partners, we can be able to sit and be able to deliberate so that we can be able to plan and see how best we can be able to discuss matters climate change and health. So Khalid, welcome everyone. I want to say this is very important, as Katriona has said, that as we discuss this, surviving the storm, and we want to explore the hidden impacts of climate change, especially in relation to health. Therefore, your presence today, I want to say, is very deeply appreciated. And we have a lot of thanks to you for finding time and for dedicating your resources, more so your time, because time is the most crucial resource that you'll ever have in this world, so that we can be able to discuss this matter. As I've said earlier, it is crucial to acknowledge the gravity of the situation that we are facing today, especially around the climate change, as it is no longer an environmental concern. It has evolved into a significant public health crisis with far-reaching implications for communities worldwide, and in Kenya in particular. We are witnessing firsthand the devastating effects of rising temperatures, increasing flooding, and shifting disease patterns, particularly impacting the vulnerable populations such as women, children, and the elderly. This afternoon, when I was just seated here on my desk preparing for this webinar, I was receiving, or I've received some communications, WhatsApp messages regarding the implications of the flooding that has taken place last night and today morning. And now people are displaced, and they have to look for somewhere for accommodation. They are rushing to schools. Luckily, the schools are closing today because of the public institutions. And therefore, this just signifies the dangers or the challenges of climate change that is taking place or root in this country. The people who are being displaced are going to face a lot of challenges in relation to accommodation. Already, diseases related to floodings are all over. In some places, especially up in highlands, we did not have a challenge of malaria. Now we have mosquitoes all over. Cholera has become a challenge in most of our health institutions, the health facilities, in our homesteads. And all this is because we are not getting clean water because of the floods that are sweeping across when there's rain falls. And therefore, as an organization and in partnership with our partners, the AFIDEP and AMREF Health Africa, we have come together to organize this series of webinars, and we are aimed at shedding more light on the implications of climate change to health. As you have said, this is one area that as organizations, and especially civil society organizations working in the area of health, we need to look and identify where is our inch as these debates continue globally, regionally, and in the country. As we come down to our own countries and our villages, what messages or what discussion do we need to have around climate change? This is a key area that we need to look so that we can have our own case studies. We need to have interactive discussions as organizations and individuals so that we can be able to understand how climate change is threatening healthcare and how it is affecting the health system in our own countries, in our own villages, so that we can see what we can be able to do so that we can be able to have health systems that can be resilient to climate change. And therefore, I would want to take again this opportunity to welcome you and want us to, as we discuss this, let us try to understand what is the link between the climate change and the health systems, so that as organizations, we develop our own programs, our advocacy activities, we can be able to tell what we need to do so that we can be able to come up with resilient health systems. Climate change, again, as I've said, it is worsening the diseases. New diseases are emerging that were not there in some of our places. Because of the flooding, we already have a lot of food security issues again, infectious diseases. And also, we have also seen compromise allowed the mental health. What is the implications and what is the relationship of climate change and mental health? Finally, we need also to explore what is the link between climate change and human rights, including the right to health, so that as we deliberate and come up with the programs, strategies that can be able to strengthen our healthcare system, then we need to see how are we going to ensure that those healthcare systems are strengthened so that they can be able to address the rights-based approach, and we are not intruding or violating the rights of both the patients, the healthcare providers, and all the citizens in the country as they access healthcare. Therefore, I want to conclude by saying, welcome everyone. We are going to have a very healthy discussion, and back to Catriona to invite the moderator. Catriona, over to you. Thank you.
Thank you, Miano. So today marks the beginning of this crucial conversation, and I'm delighted to introduce our esteemed partners and collaborators who have played an integral role in making this webinar series possible. And I'd like to extend a warm welcome also to our moderator, Kennedy Mutua, who is an advocate of the High Court of Kenya. He specializes in intellectual property law, environmental social governance, and privacy, and he holds a Bachelor of Laws degree from the University of Nairobi, and is currently pursuing his master's at the same institution. His wealth of experience and expertise will guide us through today's discussion with fairness and insight. So, as we embark on this journey together, I encourage each of you to actively engage in the discussions through the chats and Q&A functions of this webinar series, and ask questions, share your insights. Your contributions are invaluable in shaping the discourse and driving meaningful change. So the webinar will be recorded, and if you hadn't registered prior to the webinar, the link will be shared on the chat function so that you can register. In conclusion, I want to express my heartfelt gratitude to all participants for your commitment to this important cause. Together, let us delve into the depths of this critical issue and emerge with actionable strategies to safeguard the health and well-being of current and future generations. Without further ado, I hand over the floor to our moderator, Kennedy Mutua, to commence today's session. Thank you.
Thank you, Catriona. for introducing me. Thank you for leading us in this conversation. And I want to thank Executive Director Edward Miano Munene for doing a splendid introduction, for breaking it down on what you're going to be doing today. I'm also sure that all of you, for those who are in Nairobi, you at around 11 midnight yesterday, you felt a lot of heat, and then all of a sudden it rained. So those are some of the things that you're going to be canvassing today. And without much ado, I want to karibisha you to the session. Karibu for our global audience means welcome. And I want to welcome the real MVPs of this conversation. I want to welcome the first person to do the initial bit. They're going to give us an overview of what it is that you're going to be doing. They'll tell us the linkage between climate change and health. They'll make us understand the linkage. They will also unveil the hidden parts about the invisible health risks that occur as a result of this. So let me introduce the first MVP, who's Bernard Onyango. Mr. Bernard Onyango is a senior research and policy analyst at the African Institute for Development Policy, AFIDEP. His work sits at the intersection between population dynamics, health, and environment, focusing on research and policy towards attaining sustainable development goals in low and middle-income areas. That is particularly Africa, some countries in Asia, Latin America, and so forth. He has recently provided technical leadership in the development of Kenya climate change and health strategy. And I'm so sure you've seen our president going on a call out, especially the area around climate change. Bernard holds a PhD in demography and urban sociology from Brown University and is a member of several professional associations, including the International Union for the Scientific Study of Population, IUSSP, and the Union of African Population Studies, UAPS. So, ladies and gentlemen, let us welcome Bernard Onyango, who's going to take us through this first session. Karibu sana, Bernard.
Thank you. Thank you so much. I hope I'm audible. So I'll just get started immediately. And first, just to thank you for the opportunity to speak to this audience on a very important topic. So today, my presentation is going to be an overview of the health risks of climate change. And I looked at the polling that was done prior to this, and it seems that a good number of people are sort of new to this topic as well. So forgive me if for those who are who are very immersed in the work around climate change and health. But what I'll be doing is really providing an overview that's useful to the range of our audience. So as the moderator has already said, my name is Bernard Onyango. I'm a senior research and policy analyst at the African Institute for Development Policy, AFIDEP. Just a quick background, AFIDEP was founded in 2010. It's a research and policy institute whose main aim is to strengthen the use of evidence among decision makers in Africa. And we do this, we do this using various models across several thematic areas that include population dynamics, health and well-being, environment and climate change, transformational education and skills development, governance and accountability, and finally, gender equality, which is a cross-cutting thematic concern for us. So just going into it, what is climate change? I think it's good to situate this. Climate change refers to the long-term changes, and I mark that long-term changes in temperature and weather patterns. And these, for those who, as you have been observing in recent decades and recent years, have been responsible for more frequent extreme events such as floods, droughts, and storm surges that we are experiencing. Since the 1800s, humans have been the main driver of climate change, primarily due to activities such as the use of fossil fuels. And that really comes out, very often. But, there are other aspects that we miss out on, such as the emissions from our food systems, which actually contribute to a significant proportion of the greenhouse gases. So these activities produce the greenhouse gases that trap heat in our atmosphere, leading to this phenomenon of global warming. So just a couple of terms to remember. Most people who are not in the climate change space at times grapple with these terms. So first, let's talk about mitigation. And mitigation refers to actions that to reduce or prevent the greenhouse gas emissions, or to enhance our carbon sinks that remove the gases from the atmosphere. And two, we have adaptation, which refers to actions that help reduce vulnerability to climate change's current or expected impacts. And lastly, resilience, which refers to the capacity of a community or environment to anticipate and manage climate impacts, minimize their damage, and recover and transform as needed after the initial shocks. And all these three are really important in the conversation on climate change and health, as we need to take actions that address mitigation, but also adaptation and resilience. So why should we care? And I just picked out some facts from the WHO that really highlight, why it's important to really think through the intersection of climate change and health. So it's estimated that up to 3.6 billion people currently live in areas highly susceptible to climate change. As you know, this is probably quite close to half the global population, which hit 8 billion people last year. Climate change is expected to cause 250,000 additional deaths annually between 2030 and 2050 from just undernutrition, malaria, diarrhea, and heat stress. So there are other factors, but just from these undernutrition, malaria, diarrhea, and heat stress, we expect additional 250,000 deaths annually between 2030 and 2050. So we also think through what are the costs of this. So it's estimated that direct damage costs to health, and this is excluding costs in health determining sectors such as agriculture and water and sanitation, which are very important, are estimated to be between 2 and 4 billion US dollars per year by 2030. Importantly, developing countries, for those lower middle income and low income countries, are the ones the countries that already have weak health systems are the ones also being impacted most by climate change and least prepared, and least prepared, and also have least response capacity to address climate change and the impact of climate change on health. So climate change is focused to significantly increase the burden of disease as we go forward. But one of the challenges, and I want to put this as a caution, is that we are still, the attribution science to accurately estimate the scale and impact of many climate sensitive health risks is still it's still a challenge to do that. And so what we know is probably underestimating the challenge or the health crisis that comes with climate change. So in summary, just to say that climate change threats to health are only partly understood, okay, but they have the potential to reverse decades of social advances. In the next slide, I want to talk a little bit about the pathways. And this is important. I usually like using this particular figure, the depiction from the WHO from a couple of years ago. So the health risks associated with climate change arise from an interaction among three factors: the climate health hazards, the populations and or natural systems exposed to these hazards, and thirdly, the vulnerability factors. So climate-sensitive health risks are disproportionately felt by the most vulnerable and disadvantaged, including women, children, ethnic minorities, poor communities, migrants, or displaced persons, and also older populations. You can also think about vulnerability at the geographical scale, by the way. And as the ED of Heraf said, I think these are important considerations to think about as we think about the rights perspective to health. The health outcomes are diverse. And maybe, sorry, let me go back to the figure itself and just talk a little bit more also about the climate related hazards. So we have a number of them. So we've talked about the extreme weather events, the heat. There's heat. There's the rising sea levels. There's air pollution. There's vector distribution and ecology, the issue around water scarcity, and also reduced food production. And I'll be talking in detail about some of these as I show you some of the examples. And then on the exposure, and this is also where you think about the systems, including the health systems, you have to consider who are the people and the communities exposed. You have to consider the health workforce. How is these climate-related hazards affecting our health workforce? The infrastructure, the health infrastructure, the energy systems, the water systems, the food systems, and the health systems in total. So I'll be down there. You have some of the health outcomes. So there's injury and mortality from extreme weather events, heat-related stress, respiratory illnesses, waterborne diseases, and other. We have zoonosis, we have vector-borne diseases, the issue of malnutrition, non-communicable diseases, and also mental and psychosocial health. So I think these are all important because usually as we think about climate change and health, my own what I've observed is that people largely look at it from a narrow lens of interest. And if you look at the government responses, especially in this low and middle income countries, usually it's a reaction to the health emergencies that arise out of humanitarian situations from the impacts of climate change and health. So some examples. I just want to point out one of the key things, and remember we're talking about mitigation. We're talking about what's the impact of human activity to climate change, right? And we know that because of the use of fossil fuels and other activities, transportation system using these fossil fuels, indoor air pollution from cooking with, for example, in those rural areas where they're still using wood fire and all that. The threat of air pollution is really big, and it affects various, it brings through various health concerns, including cognitive development and learning, respiratory infections. It affects lung growth and even birth outcomes. And so these are some of those hidden aspects that people don't think about, the adverse birth outcomes. So as a result of air pollution, there's evidence to show that it's contributing to preterm birth and low birth weight. There's very strong evidence on air pollution and its linkage to the increase in the incidence of asthma. And so, again, thinking about the vulnerability, evidence showing that there is really negative impact of this air pollution, both indoor and outdoor, on children and maternal health. The next thing I wanted to talk about is heat stress, and just to show some simulations from the Lancet Countdown 2023, showing that between 2013 and 2022, infants and older people, or older persons who are age 65 and above, experience on average 108% more days of heat waves per year than that period between 1986 and 2005. Again, if you look at in 2013 to 2022, compared to the period 1991 to 2002, the estimated average annual heat-related mortality increased by 85%. All this driven by warming, both the global warming, but also the change in demographics. So as we have older people, the proportion of older people has increased. That they are more susceptible to the health risks as related to heat stress. We have urban heat islands, increasing urban heat islands, but also implications for both physical and mental health, which at the moment remains a little bit understudied. Looking at, I'm based in maybe I didn't mention this, but I'm based in Nairobi. But looking at the case in Africa, one of the areas where, the concern around climate change and health have really focused on vector-borne diseases. And this is important because we know that global climate and land use changes are altering the reservoir host and vector distributions, and it's challenging to define how these reservoirs and vectors are going to respond to these environmental changes. But the evidence we see and what is focused is that all these changes are going to lead to increase in vector-borne diseases. And some that are not common today may become more prevalent as our climate becomes warmer. Disease-causing agents can also be transported, and this is important. We have to think about this as an issue that doesn't respect your boundaries, your geographic boundaries. So disease-causing agents can be transported across geographic boundaries, both intra and transnational. And some of these vector-borne diseases that are key on the radar now include the likes of malaria, dengue, chikungunya virus. We have the Rift Valley fever, even the yellow fever, but also other diseases such as schistosomiasis and Chagas disease. So this map just showing that these risks, depending on what time of the year and depending on seasons, the risks can actually be elevated or lower. So this just looking at the map of Africa, the reddish areas are showing spatial distribution of Rift Valley fever risks for years with the strong El Nino event for Q1, Q2, Q3, and Q4. And what you can see from this mapping is that in Kenya, in the quarter, for example, when you focus on Kenya in Q1 and 2, the risk of Rift Valley increased, but the risk is really, it's variable across time and space. So this is another aspect to keep thinking about. We talk about antimicrobial resistance, and people are concerned about, the misuse of, for example, the antibiotics. But again, there's a linkage here between climate change and health. The changes in the natural environment due to climate change, because of that increase in the spread of disease, is it also including the potential increase in drug-resistant infections? But secondly, increase in the disease as a result of the climate crisis will also likely increase the use of the antimicrobial drugs in humans, animals, and plants, further elevating this risk of antimicrobial resistance. We talk about the issues around water and sanitation issues, and we have drought and cholera. And it's important to note that temperature drives epidemics, and precipitation acts to actually disseminate waterborne bacteria. So it's hypothesized that drought leads to increased concentration of bacteria in limited water sources, and the drought also causes more risky drinking water behaviors, right? And to make matters worse, then we have the socioeconomic variables that can exacerbate these risks that include poverty, poor sanitation, drainage, water quality, and also the access to healthcare. Let me move to the issue of food and nutrition, and think about it in two ways. So I think we are all sort of very conversant with the potential threat of the increase in temperatures that can cause both floods and drought, and subsequently affect food production, right? But also there is the increase in the carbon dioxide. And while this increases the synthesis of carbohydrates such as starch and sugar, it also decreases the concentration of protein, vitamins, and minerals critical for human health. So this is very important that, we are looking at both the effect of climate change on reducing production, but also its potential impact on decreasing the quality of the food that we consume, and particularly the decrease in proteins, vitamins, and minerals. It's the Lancet Countdown report for 2023 actually estimated that the global land area affected by extreme drought increased from just about 18% between 1951 and 60 to 47% in 2013-22, further jeopardizing our water security, sanitation, and food production. These are some satellite images that just showing, going back into 2022, what was happening, and up to 20 million people in the Horn of Africa, Somalia, Kenya, and Ethiopia faced some of the worst food security risks in the last 35 years. So in a generation, we saw some of the worst food security risks at that point. I've already mentioned the issue around gender and equality, but just to say that, the climate crisis, it's not gender neutral, and extreme weather events like floods, drought, and the heat waves disproportionately impact the health of our girls and women compared to their male counterparts, but also the older persons. And then think about other aspects, maybe that, we don't usually think about too much. The sexual and reproductive health and rights, for example. Think about those who are displaced in humanitarian situations, in internally displaced camps. They are at greater risk, for example, of the sexual and gender-based violence, but also where we have, for example, the floods, where the health infrastructure is impacted negatively by climate change. They have limited access to the necessary services, including for family planning. I am going to jump onto just a couple of slides. I had more slides, but I've sort of run out of time. I know someone was coming into to the next speaker had a limited time to speak, and I can go back to some of these issues during the Q&A. But just to show you some work from a scoping review we did in Kenya in particular, and what that scoping review was trying to do was to look at map the links between exposures and climate sensitive health outcomes and health equity, and look at what the evidence available what's the evidence available on this? And we looked at the period between January 2000 and February 2023. I'll jump some of those on the and just go to mapping the research, because I think it's important. One of the things that people say that, yes, we are talking about climate change and health, but we don't have the evidence to act. And what you see is that in Kenya, actually, there's some work that has been done, mainly around vector-borne diseases, which is in the green. So you see in the green, most of the studies were on vector-borne diseases, but we also have, a wide sort of variety of topics. So some studies looking at zoonosis, others looking at health equity research, waterborne diseases, even cardiovascular respiratory disorders, but also fewer studies, injury and death, adverse pregnancy, birth or pregnancy outcomes, and also mental health conditions, and a few on on heat exposure. So, the takeaway is that environmental health research is in Kenya is concentrated in the southern regions, partly because of the population concentration in the southern part of the country. But then there are also other issues that we are looking at even in the north, where we have studies looking at topics such as malnutrition and zoonosis. And this is just showing an evolution. We did a keyword trend over the years. So starting from the extreme left is the 2010 period, and going to the 2018 period to the extreme right. And what you see is that the research topics have changed over the last decade, moving from a strong focus on vector-borne diseases to also include now, in later years, you're looking at factors such as what are the social determinants. So you see words such as household level, household livelihood, age, awareness, policy relevant. And I think that is a good thing, because we are widening the lens through which we are looking at climate change and health. And so they're just some of those studies. So in concluding, so that I can hand over to Martin, we see that we are not talking about necessarily new diseases coming about as a result of climate change, but actually the modification of existing risks. Okay. And so maybe in some areas where a disease wasn't prevalent before, then it pops up, but not that it's really a new disease per se. The impact of climate health solutions. However, that should not stop us from taking action. We already have substantial evidence to ignite policy and program action that prioritize health in climate change action. Thank you.
Asante sana Bernard. You've really given us a breakdown of the thing that we call climate change, and you've gone ahead to ask us, why should we care? And you've gone and showed us the linkage between climate change and things like the increase in asthma, premature birth. You've also given us a breakdown of various aspects of food nutrition. You've even showed us things like drought and cholera interlinkage. So now that we know why we should care, what are some of the ways in which you can build resilience and build adaptation? What are some of the strategies that we can come up with? What are some of insights that the policymakers can have? Now, There's one gentleman who's going to guide us through that. He's going to tell us the strategies, the insights for policymakers. His name is Martin Mushangi from AMREF Health Africa. But before I tell him to delve into this, the strategies, I want to introduce Martin in the CV is quite huge, but we'll try and see what I can do. So Dr. Martin Mushangi serves as Director for Population Health and Environment at AMREF, where he spearheads programming initiatives on the intersection of climate change and health. He possesses a PhD in public health, specializing in epidemiology and disease control. Martin brings to the table 17 years of focused experience, predominantly in the African public health landscape. Martin's expertise spans a wide array of domains from climate change, water sanitation, and hygiene to infectious diseases, control and implementation of sciences. He has masterminded a variety of fit-for-purpose public health programs across the African continent, adapting strategies to diverse local conditions. In his recent ventures, Martin has been instrumental in experimenting innovative public health financing models, conducting economic evaluations, and undertaking market research and health-related quality of life assessments. I don't know what that is. He might tell us what that is. A strategic player in global health. Martin also serves on the management team of Intercontinental Finnish Mondial Program. Is also an active member of International Coalition of Trachoma Control, ICTC, the Neglected Tropical Disease Network, NGO network, NNN, and various global working groups focusing on climate change and health. Before his tenure at AMREF, Martin held key roles in renowned organizations such as African Against Hunger, ACF, Media in Switzerland, and PATH in Kenya. He has also served as the Kenyan government special government in various capacities, including public health officer in disciplined forces. Oh, good soldier, as a seasoned professional. Martin is not just contributing to public health. He's also shaping its future, leveraging his expertise to tackle some of Africa's most pressing health challenges. Martin, with that long introduction, karibu sana.
Thank you so much, Mutuko, and allow me to begin by thanking all of you colleagues. Thank you so much, Edward, and the entire fraternity of Heraf for bringing us together. So I'll not do a presentation per se, so you'll allow me to speak, and I'll pick it up from where Dr. Bernard left it up. Bernard took us through, what I would call the challenges that we are facing as a result of climate change, and with special reference to health. So I would want to build on that from the philosophy of what Antonio Guterres put forward, the triple crisis, that we are facing a crisis on climate change, which Bernard has articulated very well, and that is mutually reinforcing other challenges such as conflicts. It's also reinforcing other challenges like cost. So the question is, if you put the human health at the center of all those challenges, where do we stand? Bernard has put it very well. So for me, I'll concentrate on issues to do with the solutions that we can put on the table. In the beginning of his presentation, Bernard spoke about two things: the mitigation imperatives and the adaptation imperatives. And so I'll take those two dimensions when speaking about the actions that we can take to build a resilient health system. And just to really make it simple, when you're talking about adaptation, it is the activities which we must undertake to ensure that we survive. Climate change is here. We cannot be able to reduce the risk up to zero. So what is needed is to implement activities that are going to help us to survive within that context. And I'll begin by saying that the first element is understanding the problem. And understanding the problem means that the health sector has to invite itself to undertake what is called vulnerability assessments. Vulnerability assessments, you walk through the sector, check out the risk exposures, and think through the processes that are likely to even deepen such kind of exposures. And out of risk scoring, you are able to say that this is something that you need to address, and you propose mitigation or adaptation measures. So that's the first point. Then the second point, it's needless to do an assessment if it doesn't find its way into national strategies, into the national plans, into the national budgets for action. And so for that case, the second step is more or less of working across the sectors and the way climate change is organized. The environment sector is the one which is responsible for leading this area. So developing health national adaptation plans and ensuring that there is sufficient budgets to address such kind of plans which are in place. Now, I'll go to the other step, and I'm trying to really cut them short, which is like addressing climate and health illiteracy. Out of my practice and my experience, there are very few experts in this area. So we need to invite ourselves very strongly to start building the capacities of the health workforce, so that at the end of the day, the doctor in a clinic, the nurse who is attending to the patients can be able to address the challenges which are coming now to the health center with the climate change lens. Above all, we need to engage our community health promoters. They need to understand that when a drought is predicted, it means many things. It means malnutrition, it means the diseases which Bernard spoke about, etc. And that needs to be embedded within the knowledge of works within the entire health system. So capacity building becomes a very key thing. Then the other piece I would want to touch around is around issues to do with water security. And I would want to say that we have been very irresponsible, first of all, as a nation, because we don't appreciate that Kenya, as we stand, we are at net negative in terms of water demand. We don't have enough water, in short. So we need to engage communities, we need to engage the private sector, and bend a very clear kind of water efficient utilization kind of mindset within ourselves, so that recycling, reuse, and recharge, all that which is enshrined within the approaches of making sure that efficient water use is encompassed, is properly understood. So that's something which we need to do very clearly. And again, I would want to say, if you want to interpret climate change in the easiest way, water is the main medium through which climate change is felt. Either you have a lot of it in the form of floods, or you don't have water in the form of droughts. So that is something which we need all of us to invite ourselves to address very strongly, and looking at it from the multi-sectoral approach. Then the other piece that we have to invite ourselves, it is so irresponsible for the health sector not to be able to predict and to prepare and to respond to public health emergencies, which are likely to occur because of climate change. And we see this, the moment this enhanced rainfalls, then you have vector-borne diseases like malaria, like lymphatic filariasis or elephantiasis going up. So the health sector needs to develop a system for, predicting and developing those early warning systems and preparedness kind of mechanisms, so that if such a disaster occurs, then the sector is prepared to address them without any big challenge. Now, I want to speak specifically about the issues around livelihoods and connecting the dots between livelihoods and how it affects health. At the end of the day, all of us have to buy health in a way or another. You either have to invest in the food that you eat. If you get sick, you have to go to the hospital. And that means some sort of cost, whether it is just traveling to the health facility, whether it is investing in food or healthy lifestyles. So climate change is a taker, it's a resource taker. And at the end of the day, if we don't think about how to create some resilient systems against the impacts of climate change on livelihoods, then we'll be losing the game when we are talking about health. And so there are a couple of strategies that we need to put on the table, some of them which is working with the financing sector to ensure that money is flowing to the community so that they can be able to invest, reinvest, and get money to buy health. Insurance, the issues to do with the financial literacy, ensuring that everyone understands that putting money into the pocket is actually enhancing health, and connecting that dot with the issues of climate change, and ensuring that we are putting measures that ensure communities don't fall back to poverty, which is the greatest kind of a challenge. At the end of the day, if we don't invite ourselves to work as a sector and bringing forward the issues around One Health, and I can see my colleague Anthony is here, who is One Health expert, we need to think about multi-sectoral approach and not addressing one problem at a go. So just the other day, we were having a discussion around if it is malaria, and we know malaria is actually becoming, it's increasing in incidences and prevalences as a result of climate change. The question is, if it is all about malaria, should we just now go and treat the disease? While we know very well that if you have to get malaria, there must be a mosquito, and a mosquito normally brings in a particular kind of a condition. So should we invite other sectors like the transport sector, the engineering sector, the agricultural sector to think together with us on the measures that we can put holistically to ensure that we address this kind of a menace? So thinking multi-sectoral kind of approach. And lastly, I would want to speak about the imperatives of research, and more importantly, not just doing research for the sake of it, but ensuring that there's clear extension services. That's point number one. And then point number two, that research actually finds its place within policy. It informs policy and the actions that the government and other stakeholders take. So that's something which we need to really invest. And unfortunately, whereas there has been a lot of research that Bernard already showed, and thank you so much for to AFIDEP for really taking research now, not to the northern side of the globe, but also bringing it to Africa. We need to do more research in Africa, the one which is authentic, and more importantly, listening to the citizens, listening to the ideas that exist within the communities through citizen science. And because we have the assumption that it's only empirical science, which is more or less of adding numbers and doing calculus that can give information, but we know our grandfathers, our grandmothers survived all these kind of challenges. In a way, they hand that knowledge. So harnessing that, combining it with empirical research, and then forming one whole big picture that is going to help us to develop policies and strategies which are fit for purpose. I want to stop at that, and I'll be happy to take questions and clarifications later. Thank you so much, and back to you, moderator.
Thank you so much, Dr. Martin Mushengi. You have, I'm just remembering all the quotes that, some of the memorable quotes that you gave us. Climate change is a resource taker. How to feel climate change best is through water, whether the lack of it or the plenty of it. And you've also told us that we don't have so many experts when it comes to matters of climate change. But we are fortunate enough to have another expert by the name of Anthony Odhiambo Anthony, who is a public health expert in public health and health system management, with experience spanning over 10 years in public health system and 5 years in climate change and health interventions among the pastoralist and agro-pastoralist community. So Bernard, so Anthony, I want you to just take over from where Martin, from where Mushengi has left us. You maybe show us some of the innovative adaptation initiatives, and maybe you give us also case studies highlighting specific health challenges exacerbated by climate change. Uwanja ni wako.
Okay, thank you. Thank you very much, Bernard and Martin and the moderator. Yeah, I'll be having a small presentation. Let me just see if I can start there. Well, Bernard has taken us through the linkage between the climate change and health, and Martin has also shown us what we actually need to do. And now I'll be taking you through the practical interventions that AMREF with other partners have been undertaking and see how they can be scaled up. I believe you are able to see my screen. I'm trying to put it on a presentation mode. I don't know. I can.
Yes, we can see it. We can see it.
I'm trying to put it in presentation mode. Okay, I'll just proceed. So as I've said, I'm going to give you some practical interventions that AMREF with other partners have been implementing. The first key innovation that I'll talk about is One Health service delivery model, which is basically an integrated service delivery model that try to address health impact of climate change at the interface of human, animal, and their shared environment. And the other innovation that I'm going to talk about is the community-based observation network, which is a network of community actors who are able to do daily weather monitoring, and at the same time also they do disease surveillance, focusing on the diseases that are climate sensitive. These interventions have been implemented regionally, and the key partners that are implementing these interventions are VSF Swiss, AMREF Health Africa, and ILRI. These innovations have been implemented in Kenya, Kenya, Ethiopia, and Somalia. Now, let's look at the One Health service delivery model. How does it work, and how is it addressing the impact of health impact of climate change, or how do we address the climate sensitive diseases in the areas that we are? Now, first, I want us to understand why is One Health approach is important, or why do we need it? WHO has estimated that 60% of existing human infectious diseases are zoonotic. And again, at the same time, at least 75% of emerging infectious diseases of human have animal origin, meaning at least 75% they come from the animal, or we get them through the animal, through contact or ingesting animal product. Then the other thing is that every 5 new human diseases appear every year. We'll find that 3 of them are of animal origin. And lastly, 80% of agents with potential bioterrorist use are zoonotic pathogens, meaning they originate from the animal. Now, what are we doing as AMREF to address some of these challenges? As I said, we have come up with this service delivery model, which has 3 main elements. As you can see, we have the One Health Task Force, we have MSIP, which are multi-stakeholder innovative platform, then we have the One Unit. So you find what we have done as AMREF and the partners, we've come up with this kind of model of service provision, where we use One Health to address the climate-related diseases on human and on animals, and also we're considering the environment that they share. So there is the linkage of these key elements under One Health, where we have the County One Health Task Force. They are able to train the frontline health workers, and they do the planning and monitoring of the One Health unit services. On the other hand, we have the community itself, which we call the multi-stakeholder innovative platform. And this community, their engagement in this kind of service provision is to provide oversight, and also they provide input onto what kind of health services that are needed. Our health services are need-based, or they are contextualized, as in the community are able to communicate with the One Health unit to inform them on the health needs of the community. So wherever the team or the mobile unit is moving to the community, they go with the services that are actually the community themselves requires. It is not kind of tailor-made kind of services. Then we have the partners on top, where the key partners that are implementing the project and other partners that are related to One Health. In this case, they are able to provide the technical support to the three component or the three element, and also they provide logistic support to this. Maybe just to take you into details on the composition of the core element of the One Health service delivery model. First, we have the One Health unit, which is the service provision unit. And here we have the human health workers, where we could have either clinical officer, a nurse, or nutritionist. Then we have also the frontline health service provider who are on the animal side, where we can have the animal health technician, livestock officer, or any public or private veterinary technician. Then we also have the rangeland management officer or the environmental health officer. Then we have at least one community expert or social mobilizer. Then at least one, preferably more by the community, we can have the CDR, the community health promoters, depending on the needs of the community. Then the other element is at the community level that I've said is multi-stakeholder innovative platform. In this, here we have the leaders of pastoral civil society groups within the community itself. Then we have the religious leaders, we have service providers, we have traditional healers, etc. As you can see the list, depending on the people who are available at the community at that time. Then we have at the county level, we have the One Health Task Force, who are majorly from the different relevant department of One Health. And here the key departments are health, agriculture, livestock, etc. The others would come as the need arises. And here we can have the representative from the education, meteorological, disaster management, etc. So these are the teams that are coming together to operate this, to support this service provision model, which currently we have just done bit of assessment, and we are finding from the community something that everyone is appreciating. Now, if I take you further to what are the services that are provided in relation to health impact of climate change. Under human health services, we are still providing this kind of integrated services where we have the antenatal care, postnatal care, family planning, growth monitoring, etc. Then on the animal side, even though animal health in Kenya, the services are not free, especially the curative. Majorly the preventive, like mass immunization, are voluntary, but still as the partners, we wanted to see how this innovation will work. So we've included some minor curative services, but majorly we do disease surveillance, we do the treatment, which I've said just minor. Then also with some other preventive. Then on the animal health, on the environmental health service, we have majorly the rangeland management, which we try to work with the community health committees to address this. And the other component, which is also will be coming as an innovation on its own, which I've mentioned we are going to see maybe as I move along, the community-based the community-based observatory network. Then we also have other cross-cutting services, which include waste management, and plastic removal. We also have capacity building, where we do education and awareness, gender integration, etc. So with this, we've been able to reach some milestone, which I would not want to emphasize. Under human health services, when we started this, you can see we have reached quite a number with the preventive, curative, and nutrition services. On the animal health services, especially on the preventive, which I've just said we do more of, it is more of a preventive, and in this case is mass vaccination. Whenever there is an outbreak, like recently we've just had if those of you can remember, we've just had a Rift Valley fever outbreak in northern frontier of the country, Kenya, for those who are coming from Kenya, that is. Then under rangeland management, we've also had over 1 million acres being managed with the committees that have been identified. Then also 48 acres are under intensive restoration. On the cross-cutting issues, you can see what we have reached. So that's about the One Health model service provision. Then on the community-based observatory network, this is a network of community actors, and in this case, we are working with both the key department of One Health. Here we have environment, we have health, and we have animal sector. And with this, we formed this network to support in surveillance and monitoring of weather parameters. Just to give you a bit of background, pastoral and rural communities living in remote and underserved areas of sub-Saharan Africa are particularly vulnerable to climate change. And extreme weather events are becoming more frequent and unpredictable, putting in danger human and animal lives. Even though weather prediction models have enhanced the ability to develop and share relevant weather forecast, ground-based and localized data are still very rare. Moreover, data about hazards and impact is not systematically recorded and linked to climate data or indigenous data. And enhancing access to and ability to use climate and weather-related information is essential to strengthening monitoring and focusing capability. This improvement leads to adoption of successful preventive and response strategies at the local level. Now, with this background is when, as a project, we came up with this community-based observation network to support in monitoring weather data and disease surveillance. And out of this, we do the analysis of this data and provide advisory to the community and different departments based on what forecast that is expected to come. So CBON is a system designed by HIL project to empower climate vulnerable communities reliant on natural resource in monitoring and understanding climate patterns to take appropriate actions. Yeah, CBON revolutionizes current weather monitoring capability conducted by manual weather stations, which we have installed some weather stations that we use, through digitizing them, enabling robust data recording and timely information sharing. At the same time, CBON significantly enhances existing early warning system by providing real-time geolocalized information on hazards and localized impact. This improvement substantially boosts the community's ability to make climate-informed decisions and plan effective strategies to risk mitigation and disaster management. Now, how does this work? My screen is frozen a bit. Oh. I can't jump to the next slide. Katriona, can you assist if you have if it can work on your end? It's like my screen is frozen.
Okay, let me share my screen.
My screen is totally frozen.
Pole sana, I think Katriona will help us.
Oh, I think it has come back. It is fine. I can, yeah.
Hello.
Ayub?
I stopped sharing because I was already sharing.
Can you stop and I try?
Okay, let me stop. I've stopped.
Okay. Are you able to see?
Not yet, but it's coming up. There, we can see it.
I think if I'm sharing, my mouse freezes. Just share, please. Sorry for that.
Katrina. Okay, all right.
Yeah.
Please. Sorry for
Can you
that.
see?
We can go to the other slide. There. Okay, so I was just trying to say, how does it work? The previous one, please. Okay, thank you. So how does this community-based observation network works? We have a number of steps on what they do. So step one, through measuring ground weather data, community members ensure the availability of vital climate information in previously data. So in this, we've installed a number of weather stations, majorly manual, and we've trained community health workers, community disease reporters who are having a smartphone with an app, and the app is able to take both audio and visual images, plus it's also GPS enabled. So through this, they are able to collect this weather data and any other data, and they share to the cloud-based database. Next. Yeah. Step two, they observe the impact. Ability to observe key impact of weather patterns on people, livestock, and the environment is a pivotal strength of CBON. Community observers play a crucial role in identifying and understanding the linkage between triggers and outcomes, contributing to enhancing the community's ability to prepare for and prevent adverse consequences of extreme weather and develop effective climate response strategies. So this, on a seasonal basis, we do what we call participatory scenario planning, where we bring different actors, including KMD and the NDMA, and we use the KMD prediction together with our data to develop some advisories that are being distributed to the community and other departments to make informed decision based on what is expected. Next. The third is to record the data, and the systemic recording of climate data, observed impacts, and indigenous knowledge within CBON establishes a comprehensive digital repository that bridges science and indigenous knowledge. That I've talked of participatory scenario planning. Here we also bring the community, the traditional weather observers, and together with the scientific data, we are able to analyze and come up with this advisory. With the support of cutting-edge technology by 3MAP, information management system, all measured and observed data can be recorded even without the internet. I've just mentioned this. And when a network is available, this digitization enables efficient uploading into a cloud database, ensuring easy access, analysis, and dissemination, thereby enhancing the effectiveness of decision-making and community engagement. Next. Next time, please. Okay. Then the fourth is the discussion about action. So after providing this analysis, the communities are able to come together and discuss the outcome of the data that has been analyzed. And from there, the community will be able to make decision based on the information that has been provided through the analyzed data. And with the active commitment of community observers, CBON fosters vibrant discussion on climate-related actions. This collaborative dialogue supported by local knowledge and experience, ensure effective response to proposed and implemented action. Easy to use tool, which I've just mentioned, co-designed with end users and automatically generated by 3MAP information management system, are brought by community observers for data dissemination and analysis. So that data is what they bring to the community to discuss. And this enhances accessibility and promotes inclusive community engagement, contributing to community resilience, adaptive strategies, and preparedness. Then the last step is reporting and remembering. So we are also trying to develop some kind of historical data where whatever we are collecting is very key for future use, because it will be able to, for reference, in case there is any similar incident in future, the community will be able to refer back to the previous incident and see how it was managed. So we say that CBON's robust reporting mechanism ensure the timely delivery of crucial weather-related information. This equips stakeholders with meaningful data for informed decision-making and enhances community adaptation of effective preparedness and prevention measures. Moreover, the digitized data stored in the 3MAP IMS cloud database serves as a dynamic repository, creating an invaluable history of climate impact and action. That's what I've just said. Then a comprehensive approach significantly enhances current community action plans, which traditionally rely on the memory of a few individuals. And actually, when we started this, we realized that the community could not remember exactly. They would tell you that we had incidences of drought before, or maybe flooding before, but they could not remember how these were managed and any action that was taken then. So what we are trying to do is to keep this suppository so that in future we are able to refer and learn from the previous incident that have been there before. Next. Okay, so in all this, what have we learned? What could we say that we've seen as working, and what could we learn from this that we would want to take to the next level? We've seen like engaging everybody. As you have seen, we work closely with the community, has made this kind of new innovations that we are bringing in work, because we start engaging the community from the beginning to the end. Then we've also come with the context-specific human and animal health services, which I said through the MSI piece, they are able to provide input on what kind of health services that the community actually need. The other one is the robust surveillance that informs planning and decision, and this is done through the CBON that we have just seen. Then use of locally relevant structures as entry point for the climate change and health intervention. As I mentioned, we basically use with the structure that are already existing, and in this case, we are working closely with the community health promoters, the community disease reporters, etc. Then, of course, in terms of information dissemination, we have seen that using locally adapted infographics for information dissemination has really worked. For instance, if you talk about climate change, if you talk about health, we've been able to get some infograph or pictures from the community, then they are changed into drawing, and this has made the community understand, and they really see like the things that are existing within them in the community. Then, of course, we've had also solid anthropological evidence. And before we implemented this, maybe if I didn't mention that one thing that the project had done is to do anthropological evidence, assessment, and this one provided us with evidence. And for us to come with the One Health model, from the anthropological assessment, what came out clearly was that pastoral community majorly, they tend to care more about their animals than their own health. So we thought One Health would be the best approach to take. And here we address the health of the animals first, then you take you address both the health of their livestock at the same time you also address their own health. So those are some of the few lessons that we have learned, and we think that would be taken to the next level. I think that would be the last slide. Oh, Maybe just to mention some other health challenges that would be exacerbated by climate change. Of course, others, Martin and Bernard had spoken about the communicable diseases, which are also vector-borne. Then we are also seeing issues of mental health, as some of you might be aware. In some of this area, in Kenya, for instance, the northern frontiers, they've experienced like 5 failed rainy season followed by immediate flood. And during that time, as their livelihood is basically in livestock, and losing livestock has really led to some depression and things like that. So mental health are also coming as a result of climate change. And also we have seen the destruction of health infrastructure, especially the just recent El Nino, where quite a number of health facilities were blown off and some of them submerged. And of course, we are talking of emerging and re-emerging diseases. And Martin also just mentioned some of this. We've seen, for instance, in some of the areas, we are seeing issues of malaria spreading to areas that they were never existed before. Thank you very much. I think that's the last slide of my presentation. Thank you. Over to you, Mutuku.
Thank you so much, Antonio Thiambo. We really appreciate that beautiful presentation. And just because of the time, I just want to jump straight into Q&A. And the first one just goes to Anthony. Anthony, just before you take a glass of water, our good friend called Charles Were is asking, is the data that you're talking about longitudinal or cross-sectional?
Thank you. The data we are talking about is cross-sectional. And though at the moment we are just doing a pilot within the 2 counties within the country. And the data is being, at the moment, is still not accessible to the public, but it is only accessible to the project itself. But any other person can access on request, because the database is protected and you need to get permission to get access.
Thank you, Asante sana. Katrina, there's someone whose hand is up. I don't know who. Can they unmute themselves? Katrina, can you see whose hand is up?
Yes, it's Gabriel Muswali. Let me just try and unmute him.
Please do. In the meantime, as we wait for Gabriel to be unmuted, you can just keep on asking your questions. Okay, Gabriel, let's go.
Good afternoon, good friends.
Good afternoon.
Yeah, I really would want to thank my colleagues for the wonderful presentations that they have given on climate change and health. But let me just start by maybe asking some questions that would also help us to think deeper. Is the impact of climate change on health always negative? Somehow, that may not necessarily be the case, depending on how we'd want to look at it. And 2, when you're talking about climate change, and we are looking at the impact of climate change, the indirect impact of climate change, which my friend Mr. Odhiambo has talked about. But I would have also wanted to hear about how climate change is shaping the health sector, the thinking within the health sector, particularly with respect to issues like the occurrence of pandemics. Is the climate change making us think more about health promotion and disease prevention than we have been doing? That should have come out very, very, very clearly. How are we looking at the question of climate change with respect to investment in biomedical research, to be able to understand more about the spillovers of viruses that we don't understand, which become infectious, leading to pandemics. Is climate change calling upon us to invest more in biomedical research, to make biomedical research a central agenda in our healthcare system? Or is it making us still, relegated to the periphery, as has been the case? These issues need to come out very strongly. There is the question of climate change and what is really dominating the global conversation. Climate change and the question of the protein transition. How is climate change influencing protein transition? And is protein transition a health agenda as a mitigation measure? These are the issues that we need to address ourselves to. These are conversations that we have around the globe. I would have wanted to hear more about that, so that as we talk about protein transition, transiting from proteins from terrestrial animals to proteins from aquatic sources, to be able to reduce the carbon footprint and therefore mitigate against climate change. Is that protein transition itself healthy? How are we addressing this particular issue? Okay, how are
Yes.
we? So these are very pertinent health issues that we need to talk about when we are talking about climate change. I would have loved to hear more about these particular issues. Thank you.
Gabriel, don't worry, you're going to hear a lot of it from our wonderful panelists. Any of the three gentlemen, you can just take those questions not in any particular order. You can just have a go at it, and we'll see if Gabriel is going to get all his answers today.
Okay, there's Bernard. I think I'll start. And very interesting questions from Gabriel. These issues you bring up actually they're pertinent. It's just, we are time limited, but I want to speak about a couple of things. One, just to say that generally the issue of health within climate change action, health as a priority. I think over the last few years, and as we project going forward, we believe that it's going to be more central. It hasn't been. It has been on the periphery, but that conversation, both at global level and at country level, I think that conversation is now taking more of a center stage. And I'll give you an example. In Kenya, for instance, the Ministry of Health in Kenya, if you go look at the Kenya Health Sector Strategic Plan of one of it, is it 2017 to 2022, I believe. So it's not to 2023. So it's the one that's lapsing. So there's one currently in development. That particular strategy just actually made mention of climate change as climate change once in the whole document. So it tells you that it wasn't really a priority for the ministry. If it's not appearing significantly in their strategy. But that is changing, and as I probably was earlier mentioned, there's been the development of a strategy by the ministry, climate change and health strategy, which will soon be launched. And this is really looking over the next 5 years what priorities the ministry needs to address. And so there's the issue of within the health sector, the health sector actors taking climate change as a priority issue that they need to address. And then also within now the climate change action area, that health is made a priority in that space as well, which have not been the case before. And as part of the, the global efforts to get that going, last year, for the first time, at the Conference of Parties in Dubai, there was a dedicated health day, but also just the focus. Prior to that and post that major event, which is where sort of the main decisions around climate change action, global action is taken. So there are steps being made in the right direction. There is need to definitely hasten the action. As I mentioned, there is some evidence on the table that we can use to already take policy and programming action, but there are also still major gaps. Those have been, some have been identified. You also talk about, so that is, as Martin said, one of the reasons why there's a push to have all these countries do an adaptation and vulnerability assessment to understand the risks and really come up with robust health national adaptation plans to take action. You talked about as well the protein transition agenda. So yes, I think that those are conversations that are taking place, maybe to different degrees depending on the world region, yeah. And so as a mitigation measure, as I think I did mention that people think about the fossil fuels, but we know that part of one of the major contributors to the greenhouse gases globally, if you put together, is actually what's coming out from food systems and mainly like the issue about rearing cattle and all that. So when you talk about the protein transition agenda, it is an important agenda. It is also political. And so part of what we, as actors, what we need to do, I mean, even the climate change issue in itself is a very political issue globally. And so for people in this sector, for people working at these intersections, to be able to make a case, and I think this case for health is very important, because anybody who sees that in fact there's something that can cause these huge costs to our health, then would be more motivated to take action on climate change. So I think health sector is one of the areas that can actually help us advance on actions, climate change action. But it is political, so we have to put our evidence together, but also be able to do our communication and advocacy in a way that brings all the actors to the table, and for us to work together. So I'm going to leave it at that and pass it on to my colleagues who can also weigh in on your questions. Thank you.
Okay, maybe if also I can just say something on that. Yes, Gabriel, you are very right. And other than the negative impacts of climate change on health, of course, there are some positive ones, and I would mention just at a local scale, as you can see, a lot of improvement is done as in regards to surveillance and preparedness, because of what we have seen previously and what we have seen as impact of climate change. I think the ministry and other partners are really, a lot is being done to ensure that the surveillance, both for the general one and also the climate related kind of disease, I would say yes, it has made the health sector to start thinking on how the improvement can be done on in regards to surveillance and preparedness. Then also, I think there have been conversations on innovation, on how because we know each and every area has different impact as far as climate change is concerned. So I know there have been talks about how the research to get the specific impact of climate change in specific areas and what kind of innovations can be developed, I mean, to mitigate such kind. And also, you talked about the transition from protein, I mean, animal protein, something like that. I know what is going on, like if I be very specific to the pastoral regions in the country, most of them, they've been relying on animal product as a protein. And I just mentioned in my presentation that we have seen quite a number of livestock lost due to drought, and even flooding also. Most of them still died because of hypothermia. So with this, there's this conversation on how people can transit from relying on this kind of, livelihood that depends more on livestock to other things. And as an organization and with other partners, we are really pushing to see how we can support these people to transit from over-reliant on the livestock, then they can do other things like maybe the transition to agriculture or agro-pastoralism. Some of these things actually has opened up avenues where people, I mean, the health sector has to think just beyond. So I would say yes, other than the negative impact, but they also have a positive impact in terms of development, innovation, and research and things like that. So it's something, there are conversations that are going on, and we believe we will get something better other than just talking about the negative impact of climate change. Thank you.
Thank you. Angie is asking whether it's possible to have contacts of the experts. Yes, Angie, that can be shared. So how is intersectionality of climate change and health affected by power structures? That's one. Number two, how does urbanization affect the health impact of climate change? And number three, that has been answered. So any of our panelists can take those two questions.
Okay. Yeah, I'm not sure. Is Martin still there? I know he had to drop. So Martin, feel free to jump in if you're still on the call on some of these questions. But maybe let me talk a little bit about the urbanization. Then I'll touch on the first one. So I think we are talking about this issue of climate change and health being really a multi-sectoral. And one of the things we know, just thinking about urbanization, as the rapid urbanization is happening, think about Africa, which was the least urbanized world region, but by 2050, more than half of the population in Africa is going to be living in urban areas. We know that in the urban areas, we are losing our green spaces, for example. And as the global warming is happening and we are seeing more episodes of extreme heat, as I showed in some of that data, then, as we are creating these urban heat islands, really, it's going to have an effect on health. As we saw, young people, children, and older persons are particularly vulnerable to heat. So at the moment, every year when we have this during the summer, you hear from the global north, lives lost to heat, heat stress. You don't hear so much about that in Africa, partly maybe because we are not looking at it, but also the proportion of those of older persons is much smaller in Africa, but is changing and is in absolute numbers. Those numbers are growing quite fast, and therefore, this is something that has to be needs to be addressed, and it can't just be addressed by the health sector, because the health sector probably dealing with the effects There, we have to bring in professionals, for example, in the built environment, who are the urban planners, the architects. So it really calls for a well thought out policy process that involves also urban planning and how we can really build a resilience of the urban communities against the global warming. The intersectionality between climate change and health. As I've said, maybe I've touched on it a little bit, but this climate change in itself, forget about climate change and health. Climate change in itself is quite a political issue, and I think you all hear debates every year when we get to the community conference of parties. The demands from the least developed countries, making that case that yes, there needs to be when we talk about these transitions, there need to be just transitions to net zero. For example, we contribute, the developing countries contributing very small proportion to global warming, and then really taking on the brunt of the negative impacts of climate change, including on aspects of health, and how we navigate these conversations, how we navigate the conversation, for example, on even transitioning to green energy and leaving behind the fossil fuels, and what do these mean for different economies. You've had the arguments coming from some of the likes of India and China, who are saying, well, why should we be forced to cut down on emissions while these fossil fuels were sort of the engine of growth for the for the developed world, and how do we mitigate that? And then so I think there's the issue about power structures is very important. But even talking about where climate change and health in particular, where does the health sector sit within the power structures of decision making on climate change action? And for the longest time, the health sector has been far away from the decision making table, and now those efforts are being made to make sure that health agenda is actually brought in to the center of those discussions, whether it's on mitigation, whether it's on adaptation, whether it's on the issue of loss and damage, whether it's on the climate finance. So there are all those, and health is coming to the table late, so they have a lot of catching up to do, and just learning the ropes of the negotiations, which are very tough, and it takes a long time to actually get to actually even get those resolutions and recommendations. But as we've seen from the Paris Agreement that's now over 10 years old, that even when you get to have some resolutions, the action itself is again can be quite protracted, and lots of negotiations to be done around that to actually get the action happening. So yes, the power structure is very important to learn and navigate for climate change and health experts who are interested in this subject. Thank you.
Thank you, Bernard. This goes to Anthony. Has AMREF conducted any studies on the impact of climate change on mental health issues? If yes, is the information available and accessible to public? That is Juliet Akoff.
Okay, thank you very much. Yeah, this is one area that I must say is still missing among the effect of climate change. Actually, as AMREF, we haven't done any research, and what I just mentioned, that we have seen a need, because I remember I explained what is happening, and we have seen that there is a need. Mental health issues are also becoming issues that are being brought about by climate change. and need something to be done. So actually, as an organization, we haven't done, but it's something that, and we've been thinking about, and that's why I mentioned it. So it's something that we are still yet to do and see how we can, because it's true, the information is still missing on the impact of climate change on mental health. Thank you.
Thank you. Roslyn Onyango is asking Dr. Mushangi, who is not here. So someone will have to, one of you will have to take. I'm just curious on how matters of tax justice or fiscal policies can also elevate the impact of climate change and the right to mental right to health. What are some of the recommendations we can bring forward to policymakers and stakeholders on matters financing? Any of you, any of the gentlemen can take that.
Yeah, I think I've touched on it a little bit. I'm not really an expert in the area per se, but what I can say is that, you know, we can actually leverage the issues around climate change and health, as we are talking about the climate finance mechanisms that are in place. How do we bring health into this equation? For example, we know that health sector is one of the areas, you know, one of the areas that, or the sectors that is quite heavily funded by governments. And while we still you know that we still have lots of needs, I think what are some innovative ways to mobilize resources for the health sector? And this climate finance is probably, you know, one of those, because if you can actually make a good case that the impact of climate change on health needs to be addressed, and whether it's looking at areas where the mitigation action is to be done, or whether looking at adaptation action, there is possibility of making a case. And some of the, you know, like if you look at the climate finance mechanisms in place today, and see whether the people have actually been putting in the health sector has been putting in proposals. Then the health sector proposals, if at all they are there, they're very few and far between, as compared to maybe the likes of the transport and the energy sectors. And so these are platforms that we can actually use and we can leverage to get some form of you know, to support funding the health sector and improving health rights. So yeah, and I think that the question was is also specific to tax justice, which I'm not in a position to eloquently speak about, but I think that my answer does address some of the issues she's put on the table. Thank you.
Thank you. I think you know our session is good when there are millions and millions of questions. But I want to inform our audience that this is, I think, part one of a longer series that we're going to have. So we're going to have multiple of these interactive sessions. I know we have only 4 minutes left before Zoom cuts it out. So I'll just hand over to Catriona, and some of these questions can be forwarded to the relevant speakers, and then they can have the conversation. Catriona, over to you.
Thank you so much, Kennedy. And as we conclude this enlightening webinar, I extend my gratitude to our esteemed speakers for sharing profound insights. Bernard's overview underscored the complex health risks of climate change, especially in East Africa. He highlighted challenges such as air pollution, heat stress, and antimicrobial resistance. And he also quite highlighted gender and equality dimensions and the need to address diverse vulnerabilities in our response efforts. Martin's remarks further underscored the urgency of action, stressing the need for vulnerability assessments, strategic planning, and enhanced climate change and health literacy. His insights into setting up water security, predicting and preparing for health emergencies, and recognizing climate change as a resource taker provided crucial pathways for resilience and adaptation. And additionally, Anthony discussed on the One Health project, which showcased interdisciplinary collaborations, power in addressing the complex nexus of climate change and health. So he recognized the interconnectedness of human, animal, environment, and environmental health initiatives in the One Health projects. These offer innovative solutions to mitigate climate change impacts. So as we conclude, let us carry forward the momentum from today's discussion. As we had shared earlier, this is just the first series. We are going to have other series, and the next steps are that we will basically disseminate the key insights and recommendations to all the relevant stakeholders, continue to foster collaborations. Thank you to our esteemed speakers, moderator, organizers, and participants for your dedication to this crucial cause. And let us continue this dialogue and collective action in our next webinar early in May, so that we ensure we have a healthier and more sustainable future for all. Thank you and goodbye.